Morning, Dr. Ranjan.
Good morning.
Just got a quick question. I find that most people have a real misunderstanding of what they think of people with mental health. They tend to think of them as crazy, out of their mind.
Yeah.
Why are these common misconceptions so prevalent, and what can we do to help change people's mind about the way they view mental health?
Yeah. Well, you are talking about the stigma about mental illness.
Right.
And I believe any kind of a stigma comes from lack of knowledge or ignorance. So if you look at the history of mankind, whether it was a racial stigma or any kind of a stigma about any particular kind of the mental conditions, they all come from one central theme, and that's ignorance. So we have been very ignorant about mental illnesses or brain disorders for centuries and centuries. So it's going to take some time to do away with that, but it really comes down to lack of knowledge and lack of understanding. But one of the examples that I often use with my patients or patients' families to kind of illustrate to them that these are real medical conditions is the following. The brain is part of our body as much as heart is or kidney is, and brain has its functions. As a matter of fact, brain controls every aspect of our whole being. Whatever we do, whether it's physical or emotional or intellectual, everything is controlled by brain. And if that's the case, and by the way, that's a proven scientific fact, then if any part of brain is malfunctioning, it makes sense that that malfunction will manifest itself in certain kinds of symptoms. So that's exactly what happens in what we call mental illnesses. The better term to describe that group of conditions, I believe, will be neurobiological disorders or brain disorders. For example, if a certain part of brain is malfunctioning, you may have signs and symptoms of what we call clinical depression. And we do know that certain parts of brain are particularly affected in depression. For example, hippocampal area. The hippocampal area of the brain is very much responsible for regulation of emotions and also regulations of bodily functions such as sleep, appetite, interest, sexual function, and so forth. And that is why in patients with clinical depression, we almost always notice disturbances of those functions. Also, some of the stigma, I believe, also gets perpetuated by mental health providers themselves. One of the most glaring examples that I have seen in my practice is that many psychiatrists will drag their feet on diagnosing younger children with so-called mental illnesses. And I think that's a mistake, because their thinking is that why should I put a label on these young children? It's not a label, it's an illness. If an internist makes a diagnosis of diabetes in a 6-year-old, that's not like putting a label on the child, that's just a diagnosis. So I think the health professionals often are responsible for perpetuating this kind of a stigma. So I think the society as a whole, including health professionals, particularly mental health professionals, they got to work very, very hard at this, and they got to convey this whole notion to their patients and families and caregivers that these psychiatric illnesses actually are real medical illnesses. And the biggest evidence in my mind in support of that is the fact that psychiatric illnesses actually are much more genetic than many common quote-unquote physical illnesses, for example, diabetes, breast cancer, hypertension, heart disease, and so forth. So it's my hope that with your help and with the help of my colleagues, one day we will be able to do away with the stigma completely. Thank you.
Thank you, Dr. Ranjan.